Welcome back. As colder weather approaches, antifreeze is often used in your car and around the house, so things like pipes do not freeze. Because it is so common, antifreeze poisoning is also one of the most common forms of poisoning in small animals. Joining me now live is IndyVet, Dr. James Speiser. Doctor, thanks for being here. First off,
well, thanks for having me.
Not a problem. We talked about how common it is. How does it basically happen, or maybe a couple of different ways you see it happening?
Well, as you said, we're winterizing our cars or winterizing our campers and so forth, and we spill things, or we leave it out in containers. And interestingly, antifreeze is one of the most toxic substances we have around our household for not only pets but children. And it has a very sweet taste. And although some manufacturers have added a chemical to make it less sweet, it still is a problem. It gets ingested every year. And interestingly, the ethylene glycol is not the toxic substance. It's what the body converts it into that makes it so toxic. And as little as 1 teaspoon of antifreeze in a cat will kill it. And maybe 2 teaspoons per 10 pounds of dog will kill that animal. So it's a very, very small volume of material that's required to be lethal.
So if you think your dog or your cat may have it, what are some of the symptoms you should look for?
Well, you know, initially, like in the first 30 minutes to maybe 12 hours, they'll be unsteady, kind of be a drunken sailor appearance. They might drool, vomit. They may even have a seizure because the pH in the blood gets so low. But then after 12 to 24 hours, they actually improve as the ethylene glycol is converted to the more toxic substance, so they look better. And then 36 to 72 hours later, they go into acute kidney failure. They have horrible breath. People will bring them in because their breath is so bad. They don't want to eat. They're vomiting. They're lethargic. They feel horrible. And you can even see seizures or a coma at that point in time.
So how do you go about diagnosing it and then treating it?
You know, there is a test that we have here at IndyVet, and most of the ER facilities around town have, where they can test to see whether or not the dog or cat has ingested antifreeze, but most general practices don't have those. You can check blood acid levels. That helps. There's crystals in the urine we can check for, but that means it's already started to be converted. So honestly, if you think your pet has ingested antifreeze, you need to take them in right now to an ER or a practitioner and let them know what you think, because it's very important to get it diagnosed early.
All right, aside from not using antifreeze somehow, what would you say are the best ways to avoid this?
Well, one thing, if they have ingested it, there is a drug called fomepizole that can be administered intravenously over the course of a day or two that prevents the ethylene glycol from being converted. But again, it has to be done early. So there is treatment available as long as it's done early. As far as prevention goes, clean up any spills. If you're pouring antifreeze into your car and it gets on the floor, clean it up right away. Do not store it out in an open container where a child or a dog or cat could go over and lick it. And obviously fix any leaks and dispose of antifreeze properly. Don't just throw it out on the curb to be washed down the curb.
Yeah, making even more things probably sick doing that. Dr. James Speiser, thanks for being here this morning. A lot of great tips. Thank you very much.
Thank you.
Hey, for a list of services and education opportunities at IndyVet, you can go to fox59.com/links. Be careful, Jim. I know you got a new puppy.
Yeah, I have to keep that in mind this time of the year. Scott, we're at 9:50.